Okay, so here we have a patient who presented this morning. She has the first heart sound recording was done at 9:25. The second one was done at 10, so it's 35 minutes in between these two. You can see on the first set of graphs here that they're missing a second heart sound, so she's missing that, right? You see it here, but you don't see it here and here. And we're just going to kind of flow through all these here so you see them. But you missed five within 15 seconds. So we'll start over. That's one right there. There's two more. And then as you cut across, you got another two. And you can also see that this first beat should be a little bit smoother. These should be more aligned with each other. And you don't necessarily see that. So in the second round we did, now this patient was given Cataplex F-tabs, and F-tabs helps to push calcium across the tissue border into the, or into the cellular tissues. So it takes it out of blood into the cellular tissues is what that does. And whenever you're missing that second beat, it's usually an indication that calcium isn't there. So they're either not taking enough calcium or it's not being pushed into the tissues. The body's just not absorbing it or using it. So we tried Cataplex F-tabs to see if that was actually a thing that was causing that. And obviously, when you look at the second graph, you know how nice that is. So you have second beats, and you got a little bit of a flutter here. She had that a couple times as it was going, as she was, we were looking at that. So you see that second beat, and then there's a little flutter. That's actually just a muscle kind of jiggling, doing one of those things. So as you cut across here and you look at the rest of these, you can see a good sound. On top of that, you can see that definitely smoothed it out a bit.